Closed treatment of nasal bone fracture without manipulation. The physician treats a stable, non-displaced nasal fracture. No physical manipulation of the nasal bones or stabilization from splints is necessary. Treatment includes external agents, i.e., ice therapy, and prescribing pharmacologic agents. Percutaneous skeletal fixation of carpometacarpal fracture dislocation, thumb, Bennett fracture, with manipulation. The physician manipulates a carpometacarpal fracture dislocation of the thumb to restore anatomical position and secures the bone with a wire. The physician determines the dislocated position of the bone. The bone is relocated to correct anatomical position using external manipulation. The physician drills a wire through the metacarpophalangeal joint, through the fracture, and into the proximal bone. The drill entry point dressed and the hand is splinted. Closed treatment of articular fracture, involving metacarpophalangeal or interphalangeal joint, without manipulation, each. With manipulation, each. No manipulation is necessary. The physician manipulates the bones to restore anatomical position. The hand is splinted for stabilization. Closed treatment of fracture of orbit, except blowout, without manipulation. With manipulation, no incisions are necessary. This is a minimally displaced fracture of the orbital rims or walls that can be identified on X-ray. The physician realigns the fracture bones by using manual manipulation or with bone hooks and Carroll-Gerard screws. The realigned bones are stable and no internal fixation is necessary. Closed treatment of vertebral body fracture, S, without manipulation, requiring and including casting or bracing. Closed treatment of a vertebral process fracture is only indicated if the spine is stable and the type of fracture does not require intervention. In the case of the cervical spine, the physician initially immobilizes the patient's neck and spine with sandbags or a cervical collar, as necessary. Closed treatment of vertebral fracture, S, and/or dislocation, S, requiring casting or bracing, with and including casting and/or bracing by manipulation or traction. Following dislocation or traumatic or pathological fracture of the vertebrae, the physician decompresses the spine into proper alignment and immobilizes the vertebrae. The fracture or dislocation may be realigned by manual manipulation of the spine. If traction is employed, the patient is placed supine with a halo or tongs affixed to the skull. General anesthesia may be administered. Traction is applied to the feet and the halo or tongs, decompressing the vertebrae. As the traction is increased in stages, the physician assures that there is no additional neurological deficit. Traction is removed when the desired correction of the spine is accomplished. The patient is immobilized with bracing or casting, such as a halo cast.